بسم الله الرحمن الرحيم. هنتكلم عن السيرجيكال انفكشنز part 1. This include acute non-specific surgical infections and individual acute non-specific surgical infections. For the acute non-specific surgical infections, the general principles, definitions, pathogenesis, bacteriology, complications, diagnosis, and principles of treatment. Contamination is the presence of microorganisms in the wound, while infection is the invasion of tissues by these microorganisms. For infection to occur, there should be the infectious agent, which could be endogenous or exogenous, post-reaction, non-specific immunity, and specific immunity, and the presence of a closed space. The common microorganisms in surgical infection are Staphylococci, Streptococci, aerobic gram-negative bacilli, and anaerobic bacteria. The complications of surgical infections are spread of infection, fistulae and sinuses formation, necrosis and gangrene, suppressed wound healing, immunosuppression and superinfection, systemic inflammatory response syndrome, and multiple organ failure. These are examples of the complication of infections: perianal fistula, pilonidal sinus, and necrotizing fasciitis. The diagnosis of surgical infection is made by clinical examination, laboratory studies, and imaging studies. And these are systemic and local signs of inflammations. The principles of treatment include incision and drainage, if pus is formed, excision, antibiotics, and general supportive measures. These are examples of acute non-specific surgical infections. Surgical site infection is infections of the tissues, spaces, or organs exposed while performing a surgical procedure. The causes are general host factors like old age, obesity, poor general condition, systemic diseases, immunosuppressive drugs. Local factors like poor skin preparation, improper sterilization, poor surgical technique, poor blood supply, presence of foreign body, and nature of operation. And the surgical wounds are classified into clean wounds, clean contaminated wounds, and dirty wounds. The clinical features of surgical site infection include timing is between 1st and 10th post-operative day. The early manifestations are fever and pain in the wound, and then the wound is swollen, tender, red, and could show fluctuation, crepitus, discharge. And as regards the deep infection, it could be difficult to recognize. Prophylaxis against surgical site infection include, for the patient, correction of malnutrition, control of systemic disease, avoid elective surgery in active infection, and for the surgeon, proper scrubbing and meticulous surgical technique. Prophylactic antibiotics are used for clean contaminated operations, when those and before contaminated operations. This is according to the situation. The treatment include removal of stitches, antibiotics, and if there is prosthesis or mesh, for example, and there is infection, the infection is not controlled unless this implanted prosthesis is removed. Cellulitis. Cellulitis is a diffuse subcutaneous non-suppurative inflammation. The cause of organism is gram-positive, commonly streptococci. The clinical features are systemic in the form of toxemia, local, the affected area is indurated, edematous, red, hot, painful, tender, with ill-defined itch. The itch is ill-defined. Differential diagnosis is contact dermatitis, chemical inflammation, PVT, and the treatment is by rest elevation, foot bags, antibiotics, and if no response, suppuration is suspected, and if there is suppuration, IND is performed. Erysipelas is a spreading non-suppurative inflammation of skin lymphatics. The cause of organisms are hemolytic streptococci. The clinical features also are toxemia. And locally, the affected part is indurated, edematous, rose red, hot, painful, tender, with well-defined itch. Complication is septicemia, and if it occurs in the face, cavernous sinus thrombosis could occur, and for recurrent erysipelas, it may block the lymphatics, causing lymphedema. Treatment, the patient should be isolated, and the treatment is the same as for cellulitis. The boil or furuncle is a small abscess arising in a hair follicle or a sebaceous cyst. The cause of organism is Staphylococcus aureus. The site is hairy areas. Clinical features, it is a small, red, hot, painful, tender, indurated swelling, and when suppuration occurs, will be a small abscess. Treatment is by local foams, drainage for the pus, and systemic antibiotics. Short oral operations also for the diabetic patient. And this is the foil or the front, small abscess. The carbuncle is localized acute infective gangrene of the skin and subcutaneous tissue. The cause of organism is Staphylococcus aureus. The infection starts in a hair follicle and then extends into another hair follicles in the subcutaneous tissue. And then multiple areas of necrosis and thrombosis of blood vessels occur, and skin patches slough and separate, forming an ulcer. Generally, there is toxemia locally. There is dusky red swelling surrounded by edema. There is edema surrounding the area, and there is multiple sinuses discharging the pus with a central ulcer. Treatment generally by antibiotics, controlled diabetes, multivitamins, locally by dressing with glycerin magnesia to help separation of sloughs and excision of these sloughs. Hidradenitis suppurativa is a mixed infection of upper sweat gland, which is present in axilla, perineum, or other sites. Clinically, there is multiple abscesses here, multiple abscesses and sinuses discharging the pus with excessive fibrosis in the area. Treatment is by drainage of these abscesses, repeated dressing, and antibiotics, and in resistant cases, excision of the upper sweat hearing skin is done with skin grafting. The acute abscess is a localized suppurative inflammation caused by pyogenic organisms. The commonest are Staphylococci. The organism reaches the tissue by direct access, local extension, lymphatics, or by blood. The pathology of the abscess, there is 3 zones: central zone formed by pus, intermediate zone granulation tissue, and peripheral zone by acute inflammation. This is the pathology of abscess: central pus, granulation tissue, and acute inflammation around. The fate of the abscess is resolution, pointing and rupture, spread of infection, or chronicity. Clinical features: early, there is painful tender mass, draining lymph node is enlarged and tender, and there is systemic reaction. And when pus is formed, pain becomes throbbing, fever becomes hectic, inflammatory reaction becomes localized with positive activation. CBC, this is for the blood picture. There is shooting leukocytosis with shift to the left. This is the acute abscess, so showing swelling, redness, hotness, tenderness, fluctuation, pus, and loss of function. Treatment is by incision and drainage, and for the deep-seated collection, this is done by ultrasonography or CT-guided drainage. Antibiotics is indicated in severe infections and in immunocompromised patients. Acute lymphangitis is invasion of the lymph vessels by organisms, streptococci, entering through a wound in the area. Clinical features: the affected lymphatics. Main trunks will be This is inflammation of the main trunk, main lymphatics, and this is by smaller lymphatics. Inflammation of the main lymphatics will be shown as head streaks in overlying skin, tuberous lymphangitis. Smaller will be generalized blush. Treatment is by antibiotics and applicants. Acute lymphadenitis, this inflammation of the lymph nodes due to spread of organisms along the lymphatics from a septic focus in the drained area. Clinical features: the affected lymph nodes are enlarged, painful, tender, and may show suppuration. Systemically, there is signs of toxemia, and a primary focus of infection may be found in the draining area. Treatment early by antibiotics and hot applicants, and if suppuration occurs, this is by IND. This is acute lymphadenitis, and this is lymphadenitis complicated by suppuration. It turns into abscess. Toxemia is a constitutional disturbance from absorption of toxins produced by organisms in a septic focus somewhere in the body. Clinical picture: fever, anorexia, malaise, headache, tachycardia, and treatment is by treatment of the primary focus, antibiotics, supportive measures. Bacteremia is a transient condition in which organisms circulates in the blood stream without producing symptoms. It occurs in early stages of acute infections like pneumonia and typhoid, and after operations on infected sites like dental extraction or tonsillectomy. Treatment is by prophylactic antibiotics. If there is operation in septic sites, especially if the patient is diabetic or on immunosuppressive drugs. Septicemia is a persistent bacteria with severe constitutional disturbance due to presence of bacteria and their toxins in the bloodstream. The pathogenesis is due to the presence of a septic focus, and the organism is virulent, and there is poor resistance of the patient. Clinically, there is signs of toxemia, and if neglected, and in severe cases, this could progress into septic shock, and the treatment is by antibiotics at the beginning empirically, and then according to blood culture with supportive measures and prompt dealing with the positive septic focus. Thank you.